With the healthcare climate in today's society, providers are caring for more medically complex patients. This leaves little time to spend on the process of billing and coding. This can lead to inadequate billing from a lack of proper education on clinical documentation and a non-existent feedback system to correct inaccurate billing. Proper medical billing and coding are crucial in maintaining financial sustainability and legal compliance within a clinical practice. Practices that have systems in place to prevent upcoding, downcoding, and overbilling are more likely to maintain financial sustainability and improve Medicare reimbursement rates. Both insurers and medical practices acknowledge that upcoding is a significant issue that can lead to fraud and overbilling. In contrast, omissions in medical documentation can cause providers to downcode, which leads to significant revenue losses and an inaccurate display of services rendered. Downcoding can happen due to time constraints, which can cause less precise documentation and errors of omission. Incorrect upcoding and downcoding can lead to federal penalties or imprisonment. With such high stakes, there is still a lack of educational training on correct medical billing coding. Precise documentation of patient care and services is necessary to ensure correct reimbursement from insurance companies. This includes thorough documentation in the electronic medical records of services rendered and proper usage of evaluation and management codes. Following the guidelines set by the Office of Inspector General and CMS regarding billing, coding, and fraud prevention, and using training sessions can help reduce inaccurate billing and increase revenue cycles. Practices that adopt a compliance program can minimize billing mistakes and improve proper payment of claims. Studies have found that comprehensive training sessions and standardized note templates can increase E&M coding by 78.5%, resulting in a 65% increase in reimbursement from CMS. Designating an in-house compliance officer to monitor adherence to guidelines can improve billing and coding standards in a clinical practice. Regular audits of the billing and coding practice performed by in-house compliance officers can also help coders and providers stay current on these changes. Inadequate electronic medical record documentation leads to significant revenue loss for a clinical practice. There is a need for more formal education on billing, coding, and proper clinical documentation. A quality improvement strategy involves educating providers and compliance team members on basic outpatient billing and coding. Educational in-service training has enhanced billing and coding by allowing coders to have an open line of communication with providers. Having staff meetings to discuss how to avoid making billing mistakes can lead to increased reimbursement, improved revenue cycles, and better patient outcomes.